Regrettably, we did have a substantial increase in the number of cases in the last 24 hours to 8 p.m. There were 356 cases of community transmission in New South Wales, and at this stage we understand around a third of them had some exposure in the community during that time. Tragically, there were 3 deaths related to the Delta strain overnight or until 8 p.m. last night, and of course we extend our deepest heartfelt condolences to all the loved ones of those 3 patients. One was a man in his 80s, one was a woman in her 80s, another was a man in his 70s. None of the 3 were vaccinated and all 3 died in hospital.
The numbers continue to rise. They are bouncing around. But what is it going to take? What are you waiting for to pull the trigger and further impose more restrictions, like a ring of steel, like a curfew? What is it going to take?
I think what we also have to accept is the basic fact that Delta is very different to other strains we've had. So policy positions that may have worked in the past aren't going to have effect with Delta. And that is something we need to accept. We need to accept this is a different variant and you need to approach it in different ways.
So are you saying that you've had advice that a ring of steel, a curfew and further restrictions will not work because it's Delta, and therefore this is, you've been told, the health advice is there is no further we can go on restrictions?
Oh look, if the health advice suggested to us there was further we needed to do, of course we would do that. But we also have to accept that part of the challenge we have in New South Wales is because of lack of compliance. Part of the challenge is just because Delta is very, very different to anything we've seen before.
In regards to, you just mentioned targeted strategies. In regards to Canterbury Bankstown, you've said repeatedly it's the epicentre. Are you willing to consider a harder lockdown for Canterbury Bankstown or selected suburbs there? And if there is a reluctance, is that because there is a fear that there'll be a backlash and you'd be accused of xenophobia, for instance?
Please no. I ask people to look at the facts as to how harsh the lockdown is in those local government areas. For example, other states had an authorised workers list going to 17 pages. The authorised workers list for those 8 or 9 local government areas is very short compared to what other states had. But the different point is the Delta.